Okay? Yes, boys. This is your first lecture. Before starting the lecture, again I am advising you, not order. Whenever you enter in the class, if you are late 5 minutes or 10 minutes, go enter in the class, go silently and sit down, not crossed in front. First thing. And second thing, be regular in theory and practical classes, because MBBS course is not sufficient for you people. After doing MBBS, you have to appear for pre-PG exam. After selection in the pre-PG, doing completion of the pre-PG, still we are not satisfied. Later on, do DM or MCH or DM. So try to understand. Complete this MBBS within time. Don't be late. अपना time मत खराब करो. Because once you enter in the medical science, keep yourself very serious. Serious only during the study, not every time. Right? When you are enjoy, completely enjoy. By that time, forget teaching. And when you are in the class, attend your seriously the classes and all. I wish you all will follow this. Okay? Now that today I will start the general anatomy. That will include the different part of the body and how we reach the anatomy, all that. The word anatomy is the Latin word derived from Greek word anatom, that means cutting up. Study the different tissues or the subject of the body by means of dissection. You will do the dissection of the cadaver, and after doing the dissection you will see the relation, structures, blood supply, nerve supply, all that part of the body. That you will do in the gross anatomy. As I use the word gross anatomy, means we divide subdivisions of the anatomy. The subdivisions of anatomy, first one is the gross anatomy. In gross anatomy, you will read by means of dissection and see the structure with naked eye. So, the naked eye study of the different structures, their relations or components, that is the part of gross anatomy. The second part, microanatomy, in which you will read that again the different structures of the body by means of microscope. That is the microanatomy. Besides this, yes boy, yes, were you present in first class? And why are you giving me this chance? Why don't you go by the side? I don't want this thing. I never mind if you are late 5 or 10 minutes, but I don't want disturbance of the class. Third part, developmental anatomy, also named as embryology, where you will read the different subject structure of the body by means of beginning to end. That is how the structure develops from where or which age. All that thing they will teach you in the developmental anatomy or embryology. Besides this, then comes the part, the surface anatomy. In surface anatomy, you will see Niraji, यार ये काम नहीं कर रहा है आपका? ठीक है कर रहा है, बीच में बंद हो जाता है. चलो ठीक है. Don't make knock. Go by side. ठीक है, चल रहा है. Look, in surface anatomy, on the cadaver, you will mark the different parts of the structure or the components of the body. For example, if we say that what will be the position of the liver, look this diagram. That is, this is the abdomen. In abdomen, again we divide into different parts. Hypochondric region, right hypochondric region, left hypochondric region, epigastrium, and all that. So, when we are doctor, we examine the patient. Suppose you want to examine the liver. So how you will palpate if you don't know the positions where the liver is situated? If you don't know, then you will press your hand on the left side. No. You want to examine the liver, press on this right hypochondric region. Look here. And that we will teach you in surface marking. Whatever the organ we will teach you. For example, when we are teaching you liver, they will also tell you the relation, blood supply, nerve supply, and position in the body. Go from that side. I don't want this thing again. Today is your first day. So, that thing we will teach you in surface marking. Whatever the tissue or organ we will teach you, we will also tell you about the surface marking. And in the dissection hall, the very dry cadaver are kept on the table on the side. On that table, we will show you how to surface mark the structure. So that is the part named as surface marking or surface radiology or topography. Besides this, microscopic anatomy I have told you. Now see this. What is this? The laymen say X-ray. Okay? And doctor, when writing in the prescription, they write skygram of the part which they want to see. Why? I don't want to listen any arguments. Go by side and sit down. Not yet. Side. Come back. How you select in the medical? That is side room. You have disturbed the whole class. So, when the doctor examines the chest of the person or any part of the body, first of all they advise the X-ray or the skygram of the part. For example, I want to see the chest. This is the X-ray of the chest. Okay. So, also named as skygram of the chest. Okay. And this part, so we will teach you, also show you the X-ray of particular region. And that part of the anatomy is called the radiological anatomy. That is called radiological anatomy. Then look this part. That is the part of developmental anatomy. Beside this, so all these we will teach you according to this part. Radiological anatomy, surface anatomy, gross anatomy, microscopic anatomy. Besides this, while teaching you, we will tell you about the comparative anatomy. Comparative anatomy is that part in which we will tell you that this organ or this type of the bone or this tissue in animal or in the beginning fish or like that, how they develop and how they compare. For example, try to understand. The human beings are having the clavicle. Okay. But in quadrupeds, there is no clavicle. There is no clavicle in the quadrupeds. So like that, the different parts of the body, they are compared, and depending upon how they require, what their functions need, and how their development occurs. So all these things we will teach you in the comparative anatomy. For example, आपसे एग्जाम में पूछे किस में clavicle नहीं होती, so you will ready to reply in quadrupeds. Why? Because they are using the limbs during walking, not for lifting. So, according to the function, there is changing from fish to quadruped or animal, and also in the human being. So that all the things comes into the comparative anatomy. Last is clinical anatomy. In clinical anatomy, when we know the different structures of the body, which lungs, where the lungs are present, where the heart is present, where the stomach is present, the spleen, like that. By that, all knowing these things, you can examine the patient very well or not. As I told you, if you don't know the position of the liver or spleen, you will put the hand on the wrong side. So, all these knowledge, they will help in the clinical examination. That is the part of clinical anatomy. So, by knowing all these things, you can become a good doctor, good physician, or a good surgeon. Then, in anatomy, since from the beginning, I told you the anatomical position. See the anatomical position, that is very important. When the person is standing erect, and look here, the feet are in closure position, arms are by the side, arms are by the side of the body, and another thing, looking straight, neither on the left side nor on the right side, nor downwards nor upwards, looking straight. This is anatomical position. Okay. Whatever the structures describing in the books or teaching you, all are related with the anatomical position. In the DH, then you will see the cadaver are lying on the table. When we are describing any questions or any books, all they are not related with the position of the cadaver on the table, not lying down position, in anatomical position. Okay. Another thing is, Backbenchers, are you listening me or not? Okay. Another thing, this is the anatomical position. If I pass a plane or imaginary line vertically from center of the head, look here, from the center of the head, if the plane is passing downward, that is called midline. Understand? That is called midline. Now, the part of the body which is close to the midline, that is called medial. The part of the body which is away from the midline, that is lateral. Medial lateral is clear. And another thing, the part of the structures which are close to the head, either say superior or you can say the chronicle, and the structures which are close to the feet. If you are saying the superior towards the head and inferior towards the wheels, towards the feet. So these are the terminology they will use. Before that, I want to tell you the different position of the body, which is essential to examine the patient also, or while doing the surgery when you become surgeon. यार आपको मेरा ही लगा दो। क्या बीच में बंद होता है क्या? अभी आपके पास आया जब फिर वापस चालू हुआ, अभी चल रहा है, फिर आप ये मेरे ही लगा दो जिससे मैं जाकर ले जाऊंगा, या तो ये गर्म हो जाता है। Now look the position. Anatomical position we have already discussed. Now see the second one. As you enter in the DH, the cadaver are lying on the table, and in this position, the back of the body is touching to the flat surfaces, maybe of the table, definitely of the table, not the ground. That is called supine position. So this is the supine position. And just revert to the supine position when the chest is touching to the ground, the smooth surface, flat surface. Just reverse to the supine. This position is called prone position. Supine position and prone position. And third one, look this one. The person, generally the persons are, when they are sleeping, either on the left side or on the right side, right? So look this position. This is left lateral recumbent position, and this is the right. Okay. Now look this. All these positions, the supine positions or the prone positions, you may require during the examination of the patient also. Okay. Not only in the dissection hall, but the supine position and prone positions you may use for while that you examine the patient. Okay. So you must know what is the supine position, what is the prone position. The right or left lateral recumbent positions also used. Now see this position, Kendall work position. This is called Kendall work position. In Kendall work position, look, the person is in supine position, one thing, but The point is this, that feet of the patient or the cadaver is raised. The feet of the cadaver or the patient is raised, head is down. This is called the Trendelenburg position. The Trendelenburg position, the surgeon are use this position when the patient is hypotension. Because when we raise the hypotension, you understand, BP is low. So, to increase the blood supply of the brain, the feet is raised. Feet is raised. So, surgeon use this position in hypotension patients and also when they do the laparoscopic surgery of the lower abdomen. Laparoscopic surgery is the surgery doing by me using the instrument. That is called laparoscopic surgery. So this position required the surgeon while doing these points. One is the hypotension, if the patient is suffering from the low blood pressure, or if the surgeon wants to do the surgery of the lower part of the abdomen. Okay. Now see this position. Just reverse to Trendelenburg. This position is head is raised, feet is down, and this position required the surgeon when they want to do the surgery of head and neck region. When they do the surgery of head and neck region, they require this position. What is that? Reverse Trendelenburg position. Now see this one. If you went to the ward, after the surgery, the patient had gone the surgery. We keep the patient in the ward. The doctors keep the patient in the ward, maybe the 7 days, maybe the 15 days, whatever the requirement. And the patient must get rest, also eating and doing the normal routine. For that, we keep the patient in this position. This is called Fowler's position. In Fowler's position, the patient is sitting on the bed. The back is on the rest. The purpose of keeping the back on the rest is to relax the GIT muscles. To relax the GIT muscles, so doctor advised the patient to sit in this position. So nursing staff check this position whether the patient is sitting in this position or not. The advantage of this position is to relax the GIT muscle and the person can do daily activities easily. So this is called Fowler's position. Now look this sit position. Again the patient is no doubt in prone position, but look the point. The one side lower limb is flexed at the knee joint. Look here, and slightly maybe on the lateral side. So this position is required while doing the rectal examination or the person giving the rectal enema or whatever the condition required. If the doctor want to examine the rectal examination, he will advise to keep the patient in the sit position. Another one very commonly used, lithotomy position. In lithotomy position, the patient is lying straight on the back, and that position is called supine position. But the difference between supine position and this, the lower limb of the patient is flexed at the knee joint. And this lithotomy position is very common in the vaginal delivery of the babies, the gynecologist keep this position, use this position while deliver the child in the vaginal delivery. And also this position is used while doing the surgery of the part of GIT or the lower abdominal part. And this position is called lithotomy position. So all these are the different varieties of the position which are used by the surgeon or by the physician, or you people will use. Okay, and by that time you will remember that this is the lithotomy position, this is the supine position, this is the prone position. Any doubt? Okay, good. After this, then you will read, when you will read the anatomy, you will come across, or we will also speak sagittal position, sagittal plane, coronal plane, oblique plane, transverse plane. As I have told you previously, midline of the body. If we divide the body by passing through divide the body into two halves, right half and lateral half, equal right half and left half. So what we will do? We cut the body in the center. So look this plane. The body is dividing by passing the plane in the center of the body. So if the plane is passing from the center of the body, and that will divide the body into right and left equal half. This plane is called sagittal plane. So if we divide the body, that plane is called sagittal plane. Opposite to this, if we pass the plane from right angle to the sagittal plane, look this one. Right angle to the sagittal plane. This is called coronal plane. And in the coronal plane, कैसे पास होगा? No. Copy दो. कोई चीज़ नहीं. If the plane is passing like this, so that will divide the body into anterior half and posterior half. That will divide the body into anterior half and posterior half. So this is called coronal plane. This is called coronal plane. And this is the transverse plane that divides the body into upper half and lower half. And this is the oblique plane. Alright, that thing I have told you. This is the midline. This is the coronal plane, this is the midline or median plane. After this, before coming to this adduction and abduction, the way how we teach the anatomy, there are these two ways by teaching the anatomy. Some person are teaching the anatomy in systemic anatomy. That means they take the lecture or beginning by system wise. Suppose they are teaching the respiratory system. So whatever the parts comes under the head of respiratory system, like lungs, trachea, nasal cavity, all that. So another, they are teaching the circulatory system, in which coming the heart and different arteries and veins. Like that. Excretory system, in which comes the kidneys, ureter, urinary bladder, urethra, all that. Reproductive system, like that. So that type of teaching is called systemic anatomy. And the books are mentioning in systemic pattern. When you will read the books, they describe on systemic pattern. But we will teach you the subject in the way of regional anatomy, region wise, according to the region of the body. For example, in the beginning we will start the limbs, upper limbs. then part of the thorax, and last they will teach you the part of head and neck and brain. Then comes the abdomen, lower limb. The abdomen is again dividing into the two parts, pelvis and this part. So this type of teaching is called regional anatomy. Now this diagram, look here. I hope all are you knowing the upper limb. This is the shoulder joint. This is the elbow joint. Okay, from the elbow joint, and this is the wrist joint. So between the shoulder joint and elbow joint, this part is called arm. Between the elbow joint to the wrist joint, forearm. And from the wrist joint to the fingers, that is hand. If you see the bones of the arm, there is a single bone, humerus. In the forearm, two bones, radius and ulna. And in the hand, carpal, good, metacarpal and phalanges. Alright. Now see the diagram. The part of this, in this position, that upper limb is away from the midline or not? This is called abduction. This is called abduction. If the limb is close to if from this position I bring the limb close to the body, that is adduction. Look, so try to understand. Abduction, that means away from the midline. Adduction means close to the midline. So that is the part of this. Okay, see the next diagram. At present, anatomical position, I put my hand like this, close to the body. This is called flexion at the shoulder joint. Keep your hand here and do. You feel the movement at this joint? So this is flexion at the shoulder joint. And take the hand back. This is extension. This is extension. Try to understand. Not like this. This is abduction. Look, this is flexion and this is extension. At which joint? Shoulder joint. If you want to show the flexion at the elbow joint, do like that. This is flexion at the elbow joint and this is extension at the elbow joint. Don't do this mistake. When the examiner asks you, show me the flexion at shoulder joint, generally you show like that. No. This is flexion at the elbow joint. If want to show you the flexion at shoulder joint, this is the flexion at the shoulder joint. And this is extension at the shoulder joint. Okay? Don't confuse with this. Generally, the student do the mistake. Flexion, sir. No. This is flexion at the elbow joint. And at the wrist joint, look, I am showing you at the wrist joint. Normal position, this is adduction. Okay, this is abduction. This is flexion. This is extension. Very simple. Look, keep the hand in the anatomical position. Adduction. Okay, you can feel when you are doing the movement. Feel at the joint. Why I am using the word this joint? Feel. एक finger रखिए इसके ऊपर. Okay, and this is what are this bone? Metacarpal. So at the metacarpal phalangeal joint, like this, flexion, extension. Again, you can see in the diagram, this is at the elbow joint. Okay. If you want to show here flexion extension, I have told you. Okay. Look. Or why we are using the abduction. This is medial rotation. This is lateral rotation. In abduction, what happens? That is away. And feel here, medial rotation and lateral rotation. You will not understand only today. You have to revise this. Okay? And the same thing. Look this diagram. This is in the what is called thumb. So, if the thumb is touching to the palm, this is flexion. Flexion of the thumb. And this is extension of the thumb. And same thing, abduction, this is abduction, this is adduction. Abduction of the thumb, adduction of the thumb. Look here, you are seeing this position at this joint. This is extension and this is flexion. So that is called the extension of metacarpophalangeal joint. This is metacarpophalangeal joint, and look this. This is interphalangeal joint and this is the metacarpophalangeal joint. So see this position. Look here. Claw hand. Extension here and flexion at the interphalangeal joint. Same in the lower leg. You can understand flexion. Flexion at the hip joint, same thing. Extension like this. Flexion, extension, okay, and rotation. And this is circumduction of the lower leg. That okay. All have you seen the cricket matches or played also the cricket? What will be the position of the bowler? Like that. So that movement is completion of abduction, adduction, and lateral rotation and this. So this type of movement, combination of all these movements, medial rotation, lateral rotation, abduction, adduction, that is called circumduction. करके देख लीजिए. देखिए, बॉलर, then like that. So combination of all these movements is called circumduction. So this is circumduction at the shoulder joint. This is circumduction at the shoulder joint. And same thing, the football player, they kicking the ball and like that. So they also do the circumduction at the lower leg. Another part I want to tell you that is important. This is the hand. See the surfaces of the hand. This is palmar surface of the hand. This is called palmar surface of the hand, and this is called dorsal surface of the hand. Okay, so keep this thing in your mind. This is palmar surface of the hand, and this is dorsal surface of the hand. And in the feet, the dorsal surface is upper, and the surface of the feet which is touching to the ground, that is called plantar surface. So plantar surface of the foot is the surface which is touching to the ground. Look this part. This is the plantar surface, and this plantar surface is touching to the ground, and this is the dorsal surface. So this is the dorsal surface. Okay, then you will come across, I keep the feet like this, inversion. When the plantar surface, see the diagram, when the plantar surface is facing towards midline, like that is called inversion, inversion of the feet. So this is inversion of the foot. And just reverse to the inversion, if the plantar surface is facing outward or laterally, that is called eversion of the foot. That is called eversion of the foot. ये diagram देखिए. What is happening here? Plantar flexion. This is plantar flexion. And this is dorsiflexion. Dorsal surface coming close to the lower limb. This is dorsiflexion and this is plantar flexion. So these are the various positions and planes. Now one thing I want to tell you, be afraid that there will be no infection in the dissection hall. But still you have to wear the apron, and not wear the apron, just open the button, no, close the button. The point is, why not be afraid? I know there must be the very infectious chances. No. When body comes to department, first of all we embalm the body. Embalming is done in which the solutions are injected in the body. The dead body is named as cadaver. That is called cadaver. So first of all we embalm the cadaver. The embalming solution includes formalin. As you enter in the DH, when the body comes over the table, you feel that your hand will be over the eyes. This is because of the formalin. Okay, so formalin, turpentine oil, spirit, glycerin, they are mixed with the water, and the total amount of the solution is about 15 liters. That solution is injected by giving the needle, pass the needle into the, or cannula is passed into the common carotid artery. The way of injecting are different. We can also give the injection by means of machine or by keeping the bucket at the high part. The solution is embalmed in the body, injected in the body. After embalming, the body is kept in the tank, and the tank are also filled up with the same solution. So the body is perfectly infected free. You can do the dissection very easily. Another thing, whatever the part you are dissecting, see that part, its relation, and is, suppose you are seeing the muscles, identify the muscle. What is the nerve supply of the muscle? Discuss among your friends. See the dissector also. And action of the muscles. If you are seeing the artery, see its branches, extends, and it is the branch of which common carotid artery or which part. So everything you should go through by the dissector and also discuss with your friends. That will be easier to remember the subject. So do according to that. And if you are not clear about the things, ask the teacher without any hesitation. Ask the teacher will tell you. And before entering in the DH, you must be very clear about that what part we will dissect. Read the dissector, that part. How we give the incision, how we extend the incision, and what are the structures we will reflect. Okay? I hope within this week you will purchase the dissecting instrument and dissector. Have you seen the list of the books? I prefer the book which is better for you. They are not consulting about the author or the company. The dissector I have mentioned, I think 2 or 3, but the Cunningham is not available, so you purchase the Graves dissector, the Graves, which is very nice. They give the diagram how you incise and also the parts, but you will see that. So Graves dissector and books, the gross anatomy. First one I have mentioned, the Indraveer Singh by the Subhadra Devi. See again I hope that there will be the installer will be outside the campus. Just as you will left this part, there will be must be sitting the bookseller. See the books. I never advise to purchase the book which is the installer will show you. I mention only the best 3 books. First is of the Indraveer Singh by Subhadra Devi. Second by the Guna Sagran, and third is Sham Singh. All the 3 books are good, but don't purchase the Vidi Chaurasia. Many things are wrong. Because of that, I neglected that book. So I don't show me the Vidi Chaurasia in the dissection hall, neither you read. Because there is multiple things are wrong, wrongly prescribed and wrongly written. I don't want to make my students anything wrong. Okay? Same, the embryology and this. And you need not to purchase all the 3 books of the author, any one out of 3. Okay? The dissector, only one. The Graves dissector is describing only in the one part, the complete body. Because of that, I also advise to purchase that. Same thing, embryology, only one book, not all. Have you touched this screen before entering in the class? No? Okay, we will start this next time. So as you enter in the class, touch the screen. That mark your attendance, and that attendance will be sent to NMC. Today we will take your attendance. I will not take, we will take your attendance in the dissection hall. Any problem? Not? Okay.